Grace.
Successful telehealth sessions require planning and clear instructions so that both you and your provider can devote full attention to the telehealth appointment. This video provides some basic tips for a positive telehealth visit. It assumes you've been given all the necessary information to get connected, like downloading an app or clicking on a link.
It's important to treat the telehealth appointment just as you would an in-person visit. Be on time and focus on the appointment. Also, if the visit is with you and your child, make sure they're with you and that they're aware of what to expect.
Before scheduling a telehealth visit, make sure you have a computer with a camera, a smartphone, or a tablet to use during the visit. Be sure that you have access to the internet with Wi-Fi or cell phone service, depending on the device you're using. If you need help getting connected, ask a family member or a friend to assist you. Ask them to leave the room afterward if you don't want them to be part of the visit.
I want you to lay on the bed on your stomach.
It's very important that you're in a private, secure location with good lighting for the telehealth visit. Also, you'll want to minimize distractions and background noise, so turn off music and the TV during the visit.
Wear loose clothing in case you need to show the provider some part of your body related to the appointment. Providers can see and hear a lot in a telehealth visit.
Pull your sleeve up and then hold the rash up to the camera.
I can see if you have a runny nose. I can see your eye discharge. I can see if your mouth looks dry. I can see how does the child appear. Do they appear tearful or are they happy and running around the room? I can observe their breathing. I can see a rash. There are a lot of things that I can address this way.
Remember, don't do things during a telehealth visit that you wouldn't do in the office, like answer emails or phone calls. Be as present and focused as you would in the provider's office.
Tell me a little bit about what's going on.
I've been having a sore throat for about 3 days and I'm super congested.
Follow any pre-appointment instructions. Be prepared to share the reason for the telehealth visit, your symptoms, and history. Have any prescription and over-the-counter medications you're taking handy to show your provider, as well as vitamins or supplements.
Sometimes the provider might ask you for some information, like your temperature, blood pressure, or weight. So be sure to have any devices on hand, like a thermometer, blood pressure cuff, or oximeter if you have them. A flashlight may also help with the exam.
Is this better?
Be prepared to help your provider conduct a physical exam. It's important that you listen and follow their instructions closely. You may need to adjust the camera to allow the provider to see the exam. Your provider will demonstrate how to do a self-exam and then walk you through it.
How about for a plan?
Like an in-person visit, your provider will give you follow-up instructions, including prescription information, referrals, contact numbers, and next appointment if needed.
Be sure to ask any questions you might have and share any relevant information with your provider before the visit ends. Following these simple guidelines will help you have effective and successful telehealth visits.